So magnetic resonance imaging is an evolving area that doctors looking after newborn babies utilize more and more often in order to help prognosticating issues that babies at risk of brain injuries might face. It's quite a challenging aspect because the scan requires sufficient time to obtain adequate imaging, and we need for the babies to not move during the scan. Our project aimed to look at how MR imaging processes changed in our hospital over time. So comparing our data recently, a recent cohort, to a data set collected about 15 years ago to see how our processes changed over time. We looked at in particular about the indication for imaging, the image quality as described by a specialist neuroradiologist, whether they are appropriate for interpretation, and the number of scans performed, how it changed over the years. We collected data over a 34-month period using our electronic patient records and standardized MRI reporting performers. And what we found, our key findings indicate that there has been a shift in the indications for MRI scans being performed on newborns. Now, with about 20% of scans being performed for antenatally diagnosed anatomical abnormalities of the brain, this is likely representing an improvement over time in fetal medicine and fetal sonography. We found a 700% increase in the MRI scans done per month compared to our historic cohort, which is likely related to changes in practices for neonatal management of conditions like HIE and therapeutic hypothermia, and evolving evidence indicating MRI being a good prognostication for these conditions. So we also found that about 40% of our images are of suboptimal quality, which has obvious implications, negative implications for providing information to families, as well as financial implications. So our next steps are to work alongside our radiology and radiographer colleagues to standardize our MR imaging processes, in particular looking at sedation practices to minimize motion artifacts, and to advocate for longer MR time slots as well as more MRI scanners, as this increase is unlikely to be reflected in the number of MRI time slots and MRI scanners.